Good morning, everybody. My name is Mergan Naidoo. I'm an associate professor and a head of clinical unit at Wentworth Hospital and UKZN. I'm based in the discipline of family physician in family medicine, and I'm a family physician by training. So for that, you needed to have done a master's in family medicine and the fellowship exams through the colleges of medicine. And then I further improved my qualifications by doing a PhD in health system strengthening, focused around maternal health. And I've also got other degrees in that. Recently I've just completed a master's in health professions education. So I'm a clinician, I'm a scientist, I'm an educator. So as a clinician, I'm based at Wentworth, which is both a decentralized training site for UKZN, but also a site where we render service to patients in the community. Nationally, I'm also very involved in family medicine activities. So I'm currently the president of the College of Family Physicians, which is a college which sits within the Colleges of Medicine of South Africa. The CMSA is the assessment body for all postgraduate specialist training, and it has 29 different colleges. So I am currently the president. I lead one of the colleges, which is the College of Family Physicians, and I'm glad to report that recently the college has shown some confidence in my leadership abilities, in that they have now elected me as the vice president of the College of Medicine from 2025. So that's a role that I'm looking forward to now not only overseeing one discipline, but all 30 disciplines in specialist training in the country. I also am the postgraduate rep for the Education and Training Committee. That's where we discuss all matters pertaining to training, and that is on the Education and Training Committee of the Academy, and I'm also a member of the Research Committee of the Academy. Internationally, I'm involved in a few medical education activities. So I'm a fellow of the International FAMA Institute from Philadelphia. I did my fellowship in 2019. So this is around medical education and research. And I'm currently faculty for the International FAMA Institute. And I'm also faculty for the East African FAMA Regional Institute, where I'm involved in one of the modules for developing academics. Over the years, I've developed competencies in various areas like work-based assessments, EPAs, and assessments, and also accreditation. So I've lent my expertise to academics both locally, nationally, and internationally in part of mentorship and curriculum enrichment. Recently, as I mentioned, I completed a master's in health professions education, and my research focus was to look at a really important area for undergrad training this time, and that was to look at the core curriculum, because of the explosion of knowledge, it's always difficult to determine what is enough for an undergrad student. And the tendency is for academics who are responsible for certain modules to try to make these undergrad students mini specialists in their own discipline. So it was good to do a study where we looked at getting consensus among important stakeholders on what should be in a core medical curriculum. And that was the research focus for my master's degree in health professions education, which I just completed this year through Kiel University. So I think I'm one of the few people in the medical school that has got a master's degree in health professions education as well. And as you can see, my research interests are in health professions education. And to this effect, I have, I think, in excess of 50 publications in health professions education. And I have this textbook that I am one of the editors of, co-editors of, which is a textbook for family medicine and undergraduate students. It's a South African family practice manual, which is a really important resource. It basically uses local academics to develop content for our contextually relevant curriculum in South Africa. I'm also involved in some big multi-center collaborative studies in terms of clinical research. I'm involved currently with UCT cardiology department, looking at ways, low cost ways of managing patients who present with severe forms of heart attack. It is an international study, and I'm the local PI for that. And there's various other clinical studies, usually based on our reality of what we experience in clinical care in the public sector. But recently I was also involved in looking at using the private sector to improve the management of TB. And we've just now sent our research to one of the international journals for publication. And that reveals some really good results. And I think that maybe is the stepping stone for setting up this collaboration between private and public sector, and especially around how we can use the private sector to manage chronic diseases, for example. So both communicable and non-communicable diseases, I think, are really important areas that we can strengthen the management. So this would look at also clinical research, but also health system strengthening. And around the health system strengthening, one of the areas that my PhD focused on was on looking at safety in theatre, maternal safety in theatre. So what I did study was looking at a checklist, an adapted WHO checklist for safe cesarean delivery. And we then looked at implementing it in 18 hospitals. 9 hospitals implemented, 9 hospitals didn't. And what we found was there were significant improvements in post-operative complications in those hospitals that implemented the surgical safety checklist. Following that study, the surgical safety checklist was then used as a minimum safety standard for safe cesarean delivery in South Africa. So it's now it's been included in the national guideline for cesarean delivery.